What is up, y'all? This is going to be a video response to the video series about surgery and SHTF, started by Pat Nurse, Patriot Nurse, and responded to by Hiberniason. As of this recording, I haven't watched their videos yet, and I wanted to make a response and put in my point of views without having their input influence what I say. I want to see if there's differences and stuff like that, and also, just kind of offer the opportunity for you guys to hear what a true YouTube expert has to say. What makes me a YouTube expert, you may ask? Well, I have a video camera, a digital video camera, and I know how to upload it to the internet. Anyway, first things first, categorizing SHTF. For those of you who may not know, SHTF is an acronym for when the poo hits the fan. Now, some of you may or may not know that the significance of the poo hits the fan indicates that when a piece of poo hits the fan, everybody gets it on them, meaning some sort of a calamity that affects everybody. Now, many times, I think there's a gap between what some people consider SHTF and what the realities of SHTF are. I think some people go from 0 to 100 miles an hour, and SHTF for them is a Mad Max scenario where everything is so gone that all you have is a wasteland desert, and you got to put a person on top of the table, and the only doctors left are veterinarians, and the veterinarian has to work on the people, and we gotta fight the robots or the damn dirty apes, right? But the realities of that, in my experience, are much different. There's definitely degrees of SHTF, and the ones that we deal with, I believe, are going to be very different than the ultimate Mad Max, somehow we survived through everything to get to that point. Frankly, I think the people that I'm talking to and the people who would talk to me in response are not going to survive to see that level of downfall, unless you find yourself in a country that's already in those conditions. Countries such as certain areas of Rwanda or Liberia can get pretty bad, I hear. But be that as it may, when I think of surgery and any sort of hardcore medical stuff in SHTF, I immediately look at my qualifications. My wife is a very high level in the medical field, and my best friend is a certified combat lifesaver. That makes me absolutely nothing. But through osmosis, I did learn a couple of things. While my wife was doing her schooling, they had certain questions pertaining to triage. Triage is immediate, hardcore medical response to a situation to where if you don't act on the person's condition, they will die. And some of the conditions had to do with sterile environments versus keeping a person alive. And the way the question went, pardon me, the way the question went was a patient was bleeding out on the table, and you were all out of sterile gauzes and any other means, and all that was left was the bed sheet that had been thrown on the floor. What do you do to this wound? And the correct answer in the particular scenario was you pick up that dirty bed sheet and you put it on the area and you apply the pressure and you stop the bleeding, because there was a hierarchy of the process that you do. You need to stop the bleeding, airway, circulation, stuff like that, and infection and things of that nature are something that can be handled later. That in a triage and immediate response in situation, they are secondary to keeping a person's blood in their body or opening up their airway. The other part that on the note of on sanitation and sterility has to do with if we are performing surgery in SHTF. I recall watching a video about how it was a video where it was this documented case of a MASH unit. I don't think they're called MASH units anymore, but it was it was from the Balkan conflict or one of those other wars where people had been sewn up and they had dirt or shrapnel still in their bodies, and the area became septic. So the biggest thought that I had with regards to SHTF and how we are really practical is that there will be established a sterile environment somewhere for certain things, and we need to be very, very reluctant to sew a person up in the field. You keep that wound clean, and you don't want to risk any sort of internal infection that not only can hurt the person, but if it goes too far with the way that certain staph infections are, it can hurt everybody. When it turns septic and it's a person you love and you keep them around and they're just a walking, talking infection factory, and that's not cool. So you need to be very, very cautious with how you do those things, because there's bugs out there, man. They ain't no joke, all right? But the other thing to consider in all this is there was a time, not 100, 150 years ago, where conditions such as appendicitis or an inflamed gallbladder or a bad infection too close to your brain was a fatal condition. It wasn't until around the time of the Civil War when it became a little bit more common to have more of a sterile environment, more antiseptics, and later on when the antiseptics really started taking hold, that things changed quite a bit. So you bear in mind the difference between a medical solution, which is to say medicines, holistic or otherwise, and surgery, which is just cutting off the offending component. Amputation is a real hardcore thing, and you need to think about, in the case of amputation, you're going to bleed out because there's hard arteries and things of that nature, and without a correct blood supply, the facts of the matter is many things in SHTF just become fatal. You will die of appendicitis. You will die of tonsillitis. You will die from an ear infection just because there's no solution for it. And to pine and expect there to be a solution or to think you can handle it in your living room, I think is a flight of fancy. If anything, you need to bear in mind and keep it in the back of your head to secure the means of getting injured people to the sterile environment, or reinforcing the hospital in your area or something along those lines. Just making sure that that aspect of your community is durable and can maintain itself even in a disaster SHTF scenario. So those are my 2 cents. I'm going to watch Hibernia's Sons and Patriot Nurse's video on the subject, and I encourage y'all to check them out. I'll try to put some links down in the description box, but as always, it's great to see y'all, and we'll be talking to you soon.